Good morning, everyone. I'm Dale Alexander of Alexander & Company, and we are honored that you're with us today. We truly appreciate it. A big announcement came out several Fridays ago from the governor announcing health coverage impacts to many of your employees. This got a number of phone calls from around the state to our firm, and so we've studied this issue, and Travis Riker of our healthcare team will help you get your hands around it today. We will have this content available after noon, 12 o'clock tomorrow, and I'll tell you where in just a second. We've muted all the lines because of the number of people on this call. However, there's a space on the right of your screen that allows you to type in questions for Travis. He'll attempt to answer all the questions at the end of the presentation. Any questions that he's not able to get to or that require additional research, you'll hear back from us within 24 hours. The presentation is going to be available on cafe125.com/webinars. I'll mention this again and show it at the end of the webinar, cafe125.com/webinars. All of our previous webinars are there as well as this one that will be available after 12 o'clock noon tomorrow. So with that said, let me introduce someone many of you know, one of our healthcare consultants, Travis Riker.
Good morning, everyone. I know this is probably the most fun you've ever had, and you couldn't wait to get out of bed this morning looking forward to this webinar. There are two important topics we want to talk about today. The first of which are the proposed changes from the governor's budget that Dale mentioned just a little bit ago, and also talk about the Affordable Care Act reporting. We're calling this Part II. Let me just kind of give an overview of what we're going to talk about today. Relative to the changes, this is a bit of a trial balloon so far, and it's having some difficulty getting off the ground. Many of you might even seen things in the AJC or local newspapers that there's already some public backlash, if you will, or some things going on talking about that it would be unfair for folks like bus drivers to have coverage eliminated. We also want to say that it seems to be a fairly contained situation relative to the generosity of state health benefit plan and the way that works. This is much less severe than it would be in other states, for example, Arizona. This might be a smaller problem than you expect. Many of you have probably done a little bit of research as well, but we're also going to look at some case studies we've done to kind of identify the issue and show you what those individuals might look like. And in some cases, this might even be a non-event. I think one of the things we might hear and oftentimes agree with is, how would we get these talented people who come here for the benefits if they don't have access to benefits? So we'll talk about that as well. The second part on ACA Reporting Part II, or the Affordable Care Act, we're going to build off of our last webinar. We've had 3 or 4 webinars talking about measurement, administrative, and stability periods, and how you basically formulate how do we actually identify people who don't currently have access to insurance. How do we measure those and figure out who those people are, and then what do we need to do next? And we've been focused on what we call, or the law calls, an ongoing employee, someone who's been with you for a considerable amount of time. But we also need to consider that what happens if we have new people hired throughout the year or during the summer for an August 1st start date. So we're going to talk about this transition of what you do with new employees transitioning to an ongoing employee and provide you some visual examples to make that more simplistic to understand. I think many of you are probably aware. To the extent you're not, here's just an overview of the proposed changes in the governor's budget. This has not made its way to the Gold Dome, but certainly over the next several months this will be debated and discussed. The first of which is welcome news once again that there would be another delay in the implementation of a $150 cost shift, and that's an important word, to the local district for your classified staff. Currently the proposal says that would be a delay again. Much welcome news. Unfortunately, what is not welcome is what they're doing to try to recover the dollars to make the health plan more viable, more stable, more secure, which is unfortunately eliminating coverage for any classified employee, and it's just classified employees working less than 30 hours a week. Some of you might intuitively know this, but the reason they're using 30 hours a week is because that is the new definition of a full-time employee under healthcare reform. The meaning behind the governor's proposal is that the other state agency employees don't have access to insurance for those working less than 30 hours. But everyone on this call knows that schools are a different type of organization. So as we look at the impacted individuals and we frame who are we really talking about, how widespread is this issue, who are we really focused on, these are the different various types of classified individuals. And what we've done is we've broken this down into two components. And the ones we think have the primary impact would be those in the gray at the bottom. These would be folks such as our nutrition workers, those in food service, cashiers, cooks, and also those in transportation. It doesn't mean to a lesser extent that it couldn't, and in many cases does, impact other individuals, custodians perhaps, nurses, administrative staff. There's always a possibility that this also includes other individuals, but primarily we're going to focus on probably the 85% of the people are going to fall in that gray category of food service and transportation. So what I thought we might do is look at kind of 4 different case studies. These are 4 of our clients, and what you see there on the left side are total employees at the district for a mega system with 12,000 employees, a large district with 4,500, medium with around 1,400, and small with just under 500. We then look at how many of those individuals are actually classified employees. You see that right below. And then we break that down into those 2 categories of transportation and food service, working less than 30 hours a week. So you can see how those numbers begin to reduce themselves. And then one more line looks at, of those food service and transportation workers working less than 30 hours, who are we really talking about? How many people are actually impacted by this decision? Who are the people that actually currently have coverage right now? And you'll see that that's roughly 6.5% on the mega district, or 799 people out of a total of 12,000. Certainly not insignificant. Move over to the right, you're looking at a little over 3% for large, 7% for medium, 5% for small. So it's somewhat consistent to be anywhere from about 3 to 8%, let's say. We wanted to kind of quantify the problem. If you were a corporation, and you're certainly not, corporations would have simply just made this decision and moved on. But you're not a corporation, and these people come there for the benefits, and you attract and retain talent a different way than a corporation does. But I thought it'd be important to first, and if we haven't done your data, one of the first steps you would want to do is let's quantify the issue and take a look at who we're talking about so we can present that to our superintendent, finance director, and Board of Education to first quantify the issue. The next thing, and this probably is the most important, on why is this a big deal? These are specialized positions. Let's just use an example of a bus driver. They have to have a commercial driver's license. This isn't like going to Greyhound bus and having a license and driving for a corporation. These people come for the benefits. That's the third bullet point. They take these jobs because benefits are important to them. These are also the same people that are dealing with a different type of retirement system. It's a very emotional aspect. It pays these folks very little, and it's difficult for them to live on the means that they already have. In fact, what we oftentimes hear from our clients is that these individuals, it's hard for them to even afford the health insurance they even have from state health, and oftentimes have to cut a check back to the district to pay for that. So this has a really big impact on these people. And let's face it, these are tough jobs. These are important jobs. When I'm putting my kid on a school bus, I need to know that the safety of my kid is the most important thing to me, that they get to school safely. Losing touch of that, outsourcing that, that begins to make all of us feel a little bit nervous. And so these people are touching our kids, and this is a tough job that these people have, and I think they deserve better. Let's talk about just what a few people have been asking us for is, okay, now what? If this is going to happen, what experience have you had? What are the things that we need to be thinking about? Many of you have probably already started looking at these numbers. If you haven't, there's really 6 areas I would encourage you to look into. The first would be what we see with some of our clients in Arkansas, or this continuum of health insurance changes that we even see across the country. Let me take New York, for example. You may recall the latter part of last year, we talked about this continuum of school districts paying little to none of the insurance cost to a continuum. In 1 year, districts in New York, hundreds of them, went from paying nothing to having to set up a health plan completely on their own merits, staff it, handle the administration, the complexity of the health plan, and they had 1 year to go there. And this is a continuous spectrum we're seeing to the right. To a lesser extent, let's talk about our clients in Arkansas and something we've done there. A part of the changes in Arkansas is they did officially eliminate insurance for any individual working less than 30 hours a week due to the Affordable Care Act. And some of the things we were able to do is provide videos of encouragement on here are the 5 or 6 different areas. Now that this has happened, what do you do? Where do you go find health care? Is it through your spouse? If you're over age 65, is it through Medicare? Do you have double coverage? Do you have access somewhere else? Is it possibly this next bullet point of the marketplace or the exchange? How does that work? Who do we call? What do we have to do? I know others of you looking at our second bullet point have talked about evaluating the increased hours. Many of these bus drivers might be scheduled 25 hours a week, and maybe there's an ability to find 5 additional hours at their rate of pay. What does that look like? I know one of the smaller districts that we work with in that example, it was about a $75,000 impact to their budget, relatively speaking, and I'll just go back one slide so you can see those numbers again. So that district on the far right side with 26 covered individuals is about a $75,000 impact. I don't want to say that's consistent for everyone, but if that was a benchmark, kind of take your numbers from there. If you had 100 employees, you'll multiply that by 4. We certainly are aware of the marketplace now that we're going through finishing up the second year of open enrollment with the marketplace February 15th. But the marketplace, also known as the exchanges, would be an available option. Some other people even have begun this analysis when these proposed changes happened 3 years ago, talking about how do we set up a local health plan? Does that make sense? Are we big enough? And that's when we were talking about all classified employees. So that was already a difficult conversation, and I believe we've convinced everyone and proven our point that you are best to stay right where you are as it stands today. But could that change with this? I think that's a possibility. But what would a local health plan look like? If this is a much smaller impact of individuals, what would maybe a RESA or a multi-employer consortium look like? Considerations like, how do we get in? How do we adequately share cost? I think we all know it's difficult to get our boards of education to maybe agree to even one thing at our own local district with 5 to 10 board members. Now imagine at a RESA level the complexity of getting 10 to 15 school districts to gain agreement on something complex, emotionally important, and financially important such as a health plan. Doesn't mean it can't be done, and we certainly could go down that avenue. A local health plan could be developed as well, but there are some new elements that you're not familiar with that will come into play. I'll give you an example. One of the questions, if I was to propose it on things you'd be thinking about is, if this is going to happen, what do we do? First thing I would do is quantify the problem that we talked about already. Who's impacted? If you were to take this a step further, you'd want to be step 2, gathering information on your system's employees. For example, you're going to state health, which we've coached many of you how to do, and talk about getting claims experience. What does that need to look like? What format? Honestly, can we even get it? We're talking about a specialized set of people. It's not all classified employees. It's a small section of classified employees, probably 15 to 20% overall is what we're seeing on average thus far. You would also want to give census information. And then you take that information and you would have these conversations at the RESA level or even within your own district of what would a local plan look like? How about a consortium? And I think the complexity of that is something to be mindful of. But those would be the next steps that I would do. And again, importantly, when you're doing consortiums, 3 fundamental questions. How would you get into that consortium? A RESA level seems to make some sense, but it doesn't have to be designed that way. How would we equally share costs that's fair to all parties concerned? Some people could have worse claims experience. Some people could have better than average claims experience. How do you adequately share that? And then what if something goes bad? What if something changes at your district that's not the same as in another district due to political landscape, economic impacts at a local level? How would you get out? And what impact would that have to the greater population? That's just one example of when people ask me for next steps. Those are probably the 4 things I would do. Quantify the problem, gather your information, have these discussions with your RESA and your superintendents, and then talk about what steps would look like. How do you get in? How do you share costs? And how do you get out? This last bullet point I'm always nervous putting on here because outsourcing is something that many of you do not want to consider, but some of you are already doing it. I think with outsourcing what we see is it depends on the population of people you're impacting. Again, do we want people that are touching our children in outsourced positions? That's a question, not a statement. But what we have found across the state is that things that touch children more directly, like food service, like transportation, are usually the least likely to be outsourced. You typically see that with maintenance and possibly even grounds and things of that nature, maybe even custodial. But it is an option, and it's one we think you should be mindful of, and it's out there. I'm going to close the conversation here with the state health or the governor's proposed changes, and I'm going to move into the second part of the presentation where we're going to talk a little bit more about compliance and the Affordable Care Act reporting, which we're calling Part 2 again. Just as a precursor, the only reason you're doing this reporting, these look-back, measurements, stability periods, all this insurance jargon, if you will, is you're trying to identify who is not currently eligible for insurance that maybe needs to be eligible for insurance. So that's the only thing we're going to talk about right now, not about any other employee. What do we need to do to identify people that don't have access to coverage now because state health told you they don't? But how does the federal law and the Affordable Care Act change that? Who are those individuals and what options do we have? You may remember on previous webinars, currently state health does not allow you to add these people. So there could be some type of financial penalty. But today what we're going to focus on is how do you transition a new hire, let's say someone in August, to an ongoing employee. And I'm going to give you 3 examples. I'm going to start with the one I think you're going to see the most and will be the number one situation for many of you. And I'm going to preface this whole next 10 minutes of the conversation by please don't shoot the messenger. I wish it didn't have to be this complicated. But what I'm going to do is I'm going to help you visually understand what this looks like, what things you need to be thinking about doing, and give you some parting thoughts in terms of how we could help you or how some of the systems you might already have in place can help you make this a little bit easier. Okay, so what we're seeing on this graph, and I am going to go slow, and I've got 3 examples. We're transitioning what the law calls an initial hire, or let's call that a new employee, to an ongoing employee, someone that's been there, let's say, for example, more than 12 months. What we talked about on our prior webinars, and you have seen this several times, is if we use a plan year, meaning how do we get someone ready for January the 1st, what would that look like? So that bottom set of boxes that starts in gray talks about how your standard measurement period would be November through October. Again, the standard measurement period is something you have to choose that says, I'm going to, over that period of time, collect information about the number of hours our employees work, and then I'm going to do a calculation during that light green AP administrative period to figure out how many of those employees are indeed working 30 hours a week on average. And if and when they are, you would move to a stability period, meaning they actually have access to coverage for that full year. So let me just walk through the example below and what we think is happening 99% of the time. You have an employee that during that period of time below in gray does not work on 30 hours a week. So therefore, they do not have access to coverage during your normal stability period. But let's back up a second, because this employee was actually hired, let's say, in August. What happens is, and this is a little bit different than you've heard us in the past, The law for initial employees says that the calculation of the initial measurement period, that light green, plus the administrative period, cannot be longer than 13 months plus a fraction of a month. So I'm going to simplify this, because what you're going to see is that that initial measurement period is now, I'm looking at 11 months. So you're doing a calculation, and you're looking and tracking hours for that initial measurement period for that new hire of 11 months, and then giving yourselves still 60 days to do a calculation. Is that what every one of you have to do? No, I'm simply providing you a simple illustration to get the point across today. There is some flexibility on how you do that. I think this is the most simple way to do it, but there are definitely other options. So what you see underneath that is that the employee is not working during that 11 months, 30 hours a week. So you're providing that calculation, and they actually would have to have coverage available to them if they were identified September the 1st of 2015. But you see in that red bar, I say there's no coverage. Why am I showing you the standard measurement period below and the new hire one above? Because that's the way the law is written for new hires. You actually have to double track both the initial period of time that they're hired as well as what your standard measurement period is. So in this instance, they provide no coverage in September of 2015, and they also are being tracked and also do not have access to coverage below either, which extends the period of time that they don't actually have access to coverage. Okay? That's the outcome I think you're going to see, but I need you to be aware that for those people that aren't there for that entire period of time of 11, 12 months, that you're going to have to track that information. Let me get into a second example. Again, this new hire was hired in August. When we looked at the first period of time for their first 11 months, we found out that they were working 30 hours a week. You might have a handful of folks that this applies to. And if you did, you would need to provide them that dark green section at the very top. You would have to provide them access to coverage from September of 15 through the end of August. Okay, that's their initial period of time that you're tracking as a new hire. However, we remember that we also have to concurrently, in a parallel path, track hours below. And when you look at it under a different period of time, they don't work 30 hours a week. So what you're seeing below is, we said that they would have coverage through August of 2016 above. So if you just draw that line straight down, you'll notice that all of a sudden, in August, the end of August of 2016, they then no longer have coverage starting September 1st. Okay? I'll repeat that again. I know it's a little bit confusing. You've identified them as a new hire to be needing access to coverage, which guarantees them coverage through the end of August in this example at the top. If you simply bring the end of that line down to that second one, you will have to continue offering them coverage, as we talked about above, through August. But now, because of the standard measurement period, they no longer work 30 hours a week. Starting September 1st, in this example, you no longer have to provide them access to insurance. Got one more example. In this example, same process. You're tracking the new hire, August of the prior year through July. They do work the 30 hours a week. You've identified them, and you're going to offer them insurance. You then are also concurrently tracking them below, and in this particular, if it's a long-term sub, someone that needed to be on an extended period of time, again, I think this is a relatively small margin. But you're also concurrently tracking it during your standard measurement period. Again, the measurement period is when you track the hours. That's all you're doing. You're tracking hours over a period of time. And in this situation, they actually continuously work 30 hours a week on that. So not only do they have coverage from September through August above, they get to continue coverage through December. Now, this is just one example. Once you have a new hire that transitions to the standard measurement period, you no longer are a new hire, so long as you aren't dealing with the break in service rules for educational institutions. That's no longer between 4 and 26 weeks. then you're basically having to treat them as an existing employee. But let's say, for example, that you hire someone, you do this calculation, then they come back a year later. You're starting this whole initial and standard measurement period calculation all over again. I'm going to leave that up there for a few extra seconds. And again, we're going to have this presentation available electronically as well as the audio, so you can replay this back. And I know we'll probably certainly have some questions we want to get to here in just a second as well. We're nearly done. Probably most importantly is, how do you manage this? I know it's a bold statement for me to say you need something, but I think this is not something you want to do on an Excel spreadsheet. I certainly know a few of you out there are pretty good at Excel and have taught me a few things, but I think you're going to want an electronic system, and they already exist. You have benefits and enrollment systems, many of which our clients have the luxury of having, that can provide these types of calculations, and we have these systems to help you. Many of you also have access to things like PC Genesis. I've been on webinars with PC Genesis. I think they can provide some of the data, but I don't think they're providing you the reporting that you need to be able to track this. But some of the payroll vendors that we have strategic relationships with certainly do have this capability to assist you. So whether it's our system or another, I think having a system is really important. But let me remind you of a couple things, and I believe this just changed, newsworthy. These were draft regulations. And I thought that there was actually a pretty good possibility that this could be one of the many provisions of the law that could get delayed just based on the sheer complexity of it. Things with a lot less complexity have been delayed. And this one is probably the most complex of any. So as we develop this presentation, these were draft regulations. We're combing through some of the final reporting things, and we'll have an update for you soon. But also remember, you have a special break-in service rule for educational institutions. So here's why I'm telling you this. All of these systems were built on the initial framework of draft regulations. All of these systems, regardless of who you have and who you use, are new and untested. None of your reports are going to be due till the first quarter of 2016. I know we've said this before with tracking before. Please, please, please don't wait till the fourth quarter to start these calculations. You want to be thinking about this now, at a minimum gathering the data, evaluating what systems we or someone else have to assist you with that. And more importantly, the systems that I have seen, and I've seen a dozen, not all of them correctly have the break-in service rule for educational institutions built correctly. So what I don't want to do is bring a solution or tell you that someone else has a solution that is not customized for a Georgia public school, because that is critically important. You are going to hear from vendors nonstop for the next 6 months trying to sell you something, and it's critically important to talk about one thing, and you start with this question. How many public schools do you deal with, and how do you handle the correct break-in service rules for an educational institution? I'm going to have just some concluding thoughts of just a quick recap. Again, we have the proposed governor's budget that is out there. I think there certainly will be some evolution of this over the next several months with the political sessions that are going on at the Gold Dome. And then also as it relates to the ACA Reporting Part II, this is a reality that we're facing. Please put a system in place, put a process in place. We're going to open it up for questions here in just a minute. I'm going to let Dale have some closing thoughts. And then we certainly have a couple of questions we think you might be wanting to know the answers to, but we're also going to take some time to look at the board here. I'm going to step away to look at some of these questions and see what we can do to provide you a response.
Thank you, Travis. Appreciate that. As I mentioned, the content is going to be available after 12 o'clock noon tomorrow at cafe125.com/webinars. Travis, there's a couple of questions here. Will you address what is considered consistently working 30 hours?
Sure. The healthcare reform law has changed the definition of what is considered a full-time employee. It's no longer based on job occupations or what you would consider someone you want to be eligible for insurance. What the law now says is that anyone working 30 or more hours, and I'm considering all of you to be large employers because you are, so that goes without saying, that you have to now offer insurance. But again, keep in mind that state health eligibility is written that folks like substitute teachers do not have access to insurance. So when we say consistently working 30 hours, let me give you a couple examples. If you know at time of employment this person is expected to work full-time, 1,560 hours I believe is the number, then it is your obligation, if you are aware that they are going to be working that much, to add them to your health plan. Again, adding them to the health plan to the degree state health allows you to, or there is the potential minor penalty that we talked about in the last webinar. But I would also tell you that 30 hours a week, again, is average, and I'm going to go back while we have an opportunity. Let's look at the very bottom gray bar. The purpose of this gray bar is the standard measurement period is what you're doing to measure the total number of hours worked during the time period the person is there employed. So when you say consistently working 30 hours, you're measuring that period of time during that gray section. Now, there are certainly different ways to do measurement periods. Some of our schools want to use a school year. Some of them may look at different things. We've heard a variety. This is just a simple illustration. But I wanted to just provide that as something first. And give me just 1 second. One of the questions we've heard is, Travis, you have a crystal ball. What are you guys seeing? You're pretty close with state health. What are you seeing as the future of state health benefit plan? It's a really fair question. Do I think this is going to happen? I know I'm putting myself out there a little bit here. I think it is extremely difficult for this to happen, if I'm being completely candid. At the same time, while I think this is not likely to happen, your superintendents and your boards have a responsibility, and many of you are probably on this call, to be prepared to evaluate this. And so be aware that this is something you're probably going to need to be evaluating. There were one of 6 solutions we talked about as different avenues. A lot of this started with, again, if this is going to happen, now what? You're quantifying the problem. You're doing some analysis of your personnel. You're gathering information about claims experience and census. You want to find a healthcare consultant that knows what they're doing. And more importantly, you need to work with a healthcare consultant that understands schools, not just corporations. That's extremely important. And then you want to be having these conversations at the RESA level, at the Superintendent's Association, Personnel Administrators Associations, to talk about, if we do this, what's that really look like? How do we get prepared for this? How do we work with a consultant to identify this? And if you get to the RESA level and you want to share in this experience with your peers, again, 3 fundamental questions. I know these sound simple, and each one of them gets pretty deep, but how do you get in? How do we develop this trust? We've done this personally. We have pulled a very large school in Tennessee out of a state-based plan, and I will tell you that there's a whole lot of healthcare consulting going on, but there's also a whole lot of PR and marketing, and it was a 2.5-year project. This is not something you start in October and have it ready for January 1st. They look at a couple other questions here. Yep. What was that, Dale? Okay, so what I have seen with PC Genesis, this goes back to many of you use, and there's a variety of systems, but PC Genesis is certainly one that many of you use. I was on a call recently that they have the ability to pull the reports and pull the data for you in terms of, again, during a measurement period, you're collecting data. You need the number of hours worked per day, per week, per month. You're just collecting data, Vicki. And then one of the things you want to do is take that information, but you still they don't have a system in place to help you with the reconciliation or the calculations and dashboards to say, okay, we've got this person working 30 hours a week. Now what? How do we track that? How do we communicate? What do we communicate? How do we know how to identify state health? When do we do that? So gathering the data is the thing that everyone on the phone call can certainly be doing and has been doing. But what I think is missing And what has been difficult is how many people actually have a system in place to actually take this data and put it into something meaningful that you can actually use, understand, and make good strategies around that. Another question we received is another crystal ball question. I love these. It's like saying, what's our renewal going to be next year? What are our rates? Are we expecting any more delays on healthcare reform? If so, what might they be? This is a complicated law that was initially put together by a bunch of different subcommittees with a bunch of different ideas that they basically submerged these together into one bucket, and out came this law. Many things have been changed. In our last webinar, we talked about how will the political changes both locally at a state level as well as nationally impact the future of healthcare reform. We're already seeing recently in the news the Republicans' plan to reverse this. I'll be bold and say I do not expect repeal. Everyone we are close to says that that is very improbable, would be very difficult and extremely disruptive. And so what we do think will happen is certain elements of the law may start to unwind a little bit, such as the employer mandate or these reporting regulations. Also the individual mandate, will that even still exist? Are we going to penalize people for not having insurance? I think you're going to see things like that. The medical device tax, that's just a pass-through expense to you all. Simple things like that, I think, are what you're going to see change, and that's what the Speaker of the House is focused on. Let me see if we have any others.
There are a couple more individualized questions that we'll get the systems personnel and answer those for them. Thank you, everyone, for your attention and time. We truly appreciate this. By the way, we look forward to seeing many of your superintendents and their senior leadership teams at tomorrow's Super Summit that we're hosting in Atlanta. We appreciate all that you do. Have a great day.